We're going to talk a little bit about how you hook up for a large volume paracentesis. So, once you've gotten into the collection and you've taken whatever you need for, let's say, a diagnostic para, which you can do in your syringes, then if you want to, you can hook up to do a large volume paracentesis if there is the volume that needs to be drained. And in one of the other videos, we talked about how to kind of prep. This is our vacuum container. How you can prep this before the case in a sterile fashion. So this tubing is sterile. So as you're scrubbed in, once you kind of have where you're kind of draining things from, what you can do is just hook up the tubing here. And then actually, you don't necessarily have to stick around for this process, which could take some time. Obviously, you want to keep an eye on the patient and their blood pressure and things like that. But you can actually, if you want to, kind of take something like a tegaderm, which we have here, and you can just, kind of secure your apparatus here with the tegaderm. Or you can use steri strips or whatever you'd like, but just sterile because it's close to kind of where it's punctured the patient. So you can kind of secure this here to make sure it doesn't go anywhere, and then you either your colleague can kind of unclamp or spike the bottles that will be doing the paracentesis. And then you can step out. Alternatively, if you're on your own, you can still scrub out. And then, before you scrub out, maybe what you can do is just kind of reveal the non-sterile portion so that ultimately what you can do is you can clamp the tube and then switch bottles. Depending on what kind of apparatus you're using, it's going to be slightly different. But you can clamp the tubing, unhook, and then switch bottles. So you don't actually have to deal with this region anymore. You can be scrubbed out just switching bottle after bottle as you see fit. And then because you've used the tegaderm or steri strips and you've secured this here, you don't really worry about that having that coming out. So this is just it's smart to set this up in a way that if you need to scrub out, you can, and you can still kind of hook up more bottles without contaminating the sterile region of the procedure. So it's just something that useful to go over and be mindful of before you start the case and when you're finishing the case.